health care over almost 3 years of war have caused significant damage and eroded hope. In both countries, WHO is doing what we can to support the health system to meet the enormous needs. And conflicts are not the only emergencies to which WHO is responding. Last year, we responded to 51 emergencies in 89 countries. Conflicts, outbreaks, climate-related disasters, and more. In 2025, WHO estimates that more than 300 million people will need urgent humanitarian assistance. Today, WHO launched its annual health emergency appeal with an ask of $1.5 billion to support our life-saving work for the emergencies we know about and to react swiftly to new crises. We thank the many donors who have supported WHO's work so generously in the past. Once again, the world's most vulnerable people are depending on us and depending on you for health and hope. Last Friday, WHO received reports of suspected cases of Marburg virus disease in the United Republic of Tanzania. So far, 9 cases have been reported, including 8 deaths in 2 districts of the northwestern region of Kagera. The region is home to animals that are known to be reservoirs for the virus, including fruit bats, and there was an outbreak of Marburg in the same area in March 2023. National rapid response teams have been deployed, a mobile laboratory is in the Kagera region, and treatment units have reportedly been established. WHO is supporting the government, and we have offered to provide any further support needed. We encourage the government to send the samples it has collected to international reference laboratories and to collect additional samples in accordance with normal procedure. WHO rates the risk as high at the national and regional levels and low at the global level. We have issued advice to prevent further transmission of Marburg, to provide care for those infected, and to control the outbreak. We recommend that surveillance should be strengthened at relevant points of entry and in border regions in the United Republic of Tanzania, and that neighboring countries enhance their readiness for detecting, isolating, and treating cases. At this time, WHO advises against restrictions on travel and trade. Now to the global spread of H5 avian influenza. Last year, 66 cases of H5 were reported from the United States, plus 10 from Cambodia, 2 from Vietnam, and 1 each from Australia, Canada, and China. This is the highest number of reported human cases since 2015. So far this year, 2 cases, including 1 death, have been reported in the United States and 1 death in Cambodia. Almost all these cases are associated with infected dairy cattle or poultry. H5N1 is of particular concern because since the first human cases were reported in 2003, it has killed almost half of those it has struck. Fortunately, H5N1 has not yet developed the ability to transmit easily between humans, but that could be only a matter of time. Every transmission from one animal to another or to a human is an opportunity for the virus to mutate or to mix with other influenza viruses. It's therefore imperative that the virus is not allowed to spread unchecked in animals. WHO is working closely with the World Organization for Animal Health and the Food and Agriculture Organization of the United Nations in a One Health approach to managing the threat of H5 globally. We call on all countries to strengthen biosecurity on farms, testing and surveillance, and to provide personal protective equipment to farm workers who may be at risk. We also call on all countries with outbreaks of H5 among animals to share viral samples and sequences with the WHO Global Influenza Surveillance and Response System, or GISRIS. Finally, this month, many countries around the world are raising awareness about cervical cancer. Cervical cancer is the fourth most common cancer in women globally, with an estimated 660,000 cases and 350,000 deaths each year. And yet, cervical cancer is one of the few cancers that can be prevented and cured if detected early. Most cases and deaths occur in low and middle-income countries that lack access to vaccines, screening, and treatment. On the 17th of November 2020, WHO launched a global initiative on cervical cancer elimination. Since then, dozens of countries have introduced vaccines to prevent the disease, and many are also rolling out next-generation diagnostics. Eliminating cervical cancer is within reach. If we can give all girls and women access to vaccines, tests, and treatments. Preventing cervical cancer is one dimension of WHO's work to promote, provide, and protect maternal health, which we have chosen as our theme for World Health Day this year. Margaret, back to you.
Thank you very much, Dr. Tedros. So I'll now open the floor to questions from journalists. And as I said, please indicate your name and your outlet so we can be sure that you are a journalist. We have many people wanting to ask questions. And speaking of which, the first goes to Paul Adepoju from The Lancet. And Paul, I apologize if I've pronounced your name incorrectly. But Paul, please unmute yourself and ask your question.
Yes, thank you. And I think you did pretty well with the pronunciation. So, Happy New Year. And my question has to do with the recent closed-door meeting that the regional office of WHO in Africa had regarding the leadership. So I'd like to know if we have insights regarding what the outlook looks like regarding leading WHO in Africa. And a quick follow-up question I have regarding this agreement is, what are the insights that the WHO can share regarding how public health should play, how emergency response should be in crises in regions like Gaza and other parts of the world?
So, Paul, I think that's a couple of questions, but I'll go to our legal counsel, Derek Walton, first of all, for your first one, and then we'll move to the next.
Thank you very much, Paul. And I think your first question was about the recent special session of the Regional Committee for Africa, which took place earlier this week. This was the first special session that the African Regional Committee had held, and it was called because of the very sad circumstances concerning the death last year of Dr. Faustine Ngudile, who had been previously selected by the Regional Committee to be their nominee for the post of Regional Director for the African region. Because of these sad circumstances, the region had to meet to decide how they would proceed with the matter, and as I think you may be hinting, they did look at this and they set a new timetable for a fresh election to take place. The election will be launched in the coming days with a call for proposals, and that will member states of the African region will be invited to submit candidates. They will be considered during an election campaign, which will conclude in May at a special session, a further special session of the Regional Committee for Africa, which will meet shortly before the World Health Assembly, and the Regional Committee for Africa will there make its a fresh nomination for the position of Regional Director, which will then be considered by the Executive Board in the weeks thereafter. So if all goes to plan, we should have a new regional director for Africa in place by the 1st of June of this year. Thank you very much.
Thank you very much, Derek. And I think we'll go over to Dr. Mike Ryan for the question about the response to emergencies.
Sorry, we didn't hear that. Can you repeat? Sorry, we're having audio issues here.
Okay, Paul, would you like to repeat your question? It was essentially about our role in responding to emergencies, but I think Paul put it a lot better than I will. Paul, would you mind repeating your question?
Yes, so my question is this, looking at WHO's experience in Gaza and Sudan and elsewhere, so what is the common thread that you believe should guide emergency response in such situations now and in the future?
Well, that's a very big question. It's a very important one. But I really, from our perspective, and maybe Tedros would also want to comment on this, it's getting that laser focus on the health needs of the populations we serve. There's a lot between us and that. There are logistics issues, there are political issues, there are financial issues. There are all kinds of issues that can prevent you doing what you need to do, or give you an excuse not to do it because there are other reasons why you can't get something done. So I think a laser focus on the health needs of population. Sometimes we artificially divide health needs down into humanitarian health needs and acute health needs and development health needs. Health needs are health needs. For example, here the population in Afghanistan has many acute and chronic health needs. The maternal mortality rate in this country is massive, but equally breast cancer and cervical cancer are killing many women in Afghanistan. So you can't just look at what is on the face of it, the acute risks to health. You have to look at these long-term issues in the health system that prevent basic health care, which results in many women, for example, in this country, presenting with breast cancer, presenting with cervical cancer, too late for treatment to make a difference. So you can't put these things on the back burner. You can't say that these are not humanitarian needs. They are humanitarian needs. Not getting access to a mammogram, not getting access to a cervical smear is a life-threatening absence in your healthcare journey through life, and you may die because you don't have those investigations. So I do think we need to rethink what we consider to be the humanitarian development nexus, it's so-called. We also, I think, need to see that delivery of healthcare is fundamental to building peace, fundamental to securing peace in the world. And Tedros has spoken eloquently about that in the past. So I think that focus on the health needs, the focus on using our partners to help deliver that. WHO does not do everything. In fact, if you look at it in the great scheme of things, our real role is to coordinate, to facilitate, to stimulate, to hold to account ourselves and our partners in that delivery, to engage with and coordinate with and hold to account our member states for that delivery of healthcare. So focusing on our role that amplifies the contribution and the effect that other health cluster partners have, that governments have, that's another big part of what we want to achieve over the next year. So that continued focus on service, that continued focus on facilitating the work of others, that continued focus on the health needs of the population we serve, and I think if we stick to that, we'll be doing a reasonably good job.
Thank you very much. Thank you very much, Dr. Ryan. Did you want to add something, Dr. Zakaria?
Thank you very much, and thank you also for this question. it's really to build on what Mike has already said. So when we do respond to a humanitarian emergency, we are guided by a set of strategic objectives. The first one is we want to make sure that health services are available to anyone and everyone who needs it. And so we need to take into consideration operational challenges, but also that maybe there are certain groups of people that are particularly hard to reach. And so how to even endeavor more to make sure that everyone can be reached. This needs to be made services need to be delivered based on the best possible understanding of what the needs are, what diseases are most prevalent, what is hurting, harming, and making people suffer the most. And we do this, as Mike mentioned, through partnerships, through emergency medical teams, and we try to deploy support to existing health facilities, but also deploy mobile teams and any other means to make sure that services can reach the people who need them. And the next is we want to make sure that health threats are detected early, that prevention measures can be implemented as much as possible, and that when disease outbreaks happen, that they are rapidly investigated to and responded to. An overarching element of this response is, of course, that partnership through the many different technical and operational areas. And then I would also like to mention here that the investments that we can do during more peaceful times is really essential, because what we are also seeing is that health systems that are stronger, that are more able to adjust their service delivery mechanisms are those who will be able to respond to then sudden increase of health needs across the population. So then that investment in health systems at all times to make sure that health can function is extremely critical and will determine very much the outcome of an emergency for a population. Thank you.
Thank you very much, Dr. Zakaria. And I omitted to mention, speaking of going where the needs are, Dr. Ryan is joining us from Afghanistan. So that's why sometimes we may have some problems with the sound, but it's because it might be the beginning of the year, but everybody from top down is out there doing the work. The next question goes to Rachel from Carson from NPR. Rachel, please unmute yourself and ask your question.
Hi, how is the World Health Organization preparing for a possible US withdrawal?
Thanks, Rachel. That's a very easy question to answer. This is a government in transition, and as a government in transition, they need the time and space to make their own decisions to make that transition, and we are not going to make any comment further. Oh, and the next question goes to Carmen Pound from Politico. Carmen, please unmute yourself and ask your question.
Thank you, Margaret. You already answered my first question, so I have another one. I have a question for Dr. Van Kerkhove. I saw that she wrote an op-ed, calling on governments not to forget that COVID-19 happened. And I wanted to ask her if she could elaborate a bit of why she felt the need to write that op-ed and kind of like what would she like to see governments do. I know she made the point of the pandemic treaty negotiations or pandemic agreement negotiations, but I was wondering if beyond that, there's some other things that Dr. Van Kerkhove and the WHO would like to see governments do to be better prepared for future pandemics. Thank you.
Thank you, and over to you, Dr. Van Kerkhove.
Thanks very much. So we get the question a lot of, are we ready for the next pandemic? And the Director General answered that at the last press conference with a yes and a no. And a lot of what we do in support of member states is preventing, preparing, getting ready for, to mitigate any outbreaks to prevent them from becoming epidemics and pandemics. And the world right now, largely, many people want to pretend COVID didn't happen. And I think there are many reasons for that. The last 5 years have been incredibly traumatic. We've lost at least 7 million people, but we estimate that that number of deaths is much, much higher. Everyone has been impacted by this. And what we've learned after each outbreak, after each epidemic, after each pandemic, is that that trauma that we've gone through the investments that we've made across the spectrum of surveillance, of infection prevention control, of emergency operations, of supply chain management, of clinical management, the whole spectrum. Those investments that were made through blood, sweat, and tears are investments for the current threat that we face. And let's be clear, COVID is not gone, but also helps us to use them for known threats, like we've talked about with Marburg, for example, of avian influenza, of dengue, of plague, you name it, but also the next novel threat that we face. And the reason for that op-ed was to encourage governments to continue to invest in the health systems, to continue to invest in the workforce, in people, for early detection, for transparency in reporting, and what we have put forth to be able to be better prepared. There's a lot of investments that have been made in the workforce. There are investments that have been made looking at tech transfer, looking at mRNA hubs, looking at different hubs for supply chain or for intelligence, looking at data and better use of data. We want to see those investments sustained. And it's a difficult challenge right now because governments are facing very difficult choices because of all the other complex emergencies that are happening that the DG also mentioned, war, displacement, climate effects, and so on. And so we don't want to lose sight of the infectious threats that we are currently facing. And right now in the Northern Hemisphere, for example, there's a huge burden on healthcare systems from influenza, from COVID, from RSV, from human metapneumovirus, from mycoplasma pneumonia, and we just have to make sure we just don't lose sight of that. So that was the purpose of the op-ed, and to remind everyone that while we are dealing with emergencies, like you've just heard Dr. Mike Ryan talk about sitting in Afghanistan and the work that we do in Gaza, that we have to not lose sight of those infectious threats that we face.
Thank you very much, Dr. Van Kerkhove. The next question goes to Jen Rigby from Reuters. Jen, please unmute yourself and ask your question.
Hi there, thank you. I just wanted to ask, in light of the Gaza ceasefire, when do you expect or hope to be able to get more medical aid into Gaza, and what are the most urgent items?
I think that's a question for Dr. Rick Peppercorn. Rick, you're online, I think. Yes.
Yes, I am.
Please go ahead.
Thank you. Thank you very much for the question. I think first I want to start repeating a little bit what the DG raised, like this imminent ceasefire is the best news since long times. And of course, we welcome the announcement of a deal, secure ceasefire and hostage release in Gaza. We, of course, hope that all parties will respect this commitment to fully implement the deal and work towards this so much needed lasting peace. Now, you asked a bit about WHO and its partners. Yes, they are ready to support the health system and the people of Gaza, expand this support rapidly. So scaling up operation, mobilizing critical supplies and resources to first address the immediate needs and support also, and we are already working on that, early recovery rehabilitation. What is critical though is the significant security and the political obstacles to delivering aid across Gaza are removed. So we need a rapid, unhindered and safe access and expedited flow of aid into and across Gaza. And restoring health system, I want to make it very clear, it's a collective effort. It will be guided and must be guided and executed in close collaboration with the Ministry of Health, the health workforce, the Gaza health workforce, the partners, and international community. So we also urge now, this is the time for member states, donors, and the global community to step up, to provide this flexible funding and to enable these swift and effective responses and for the urgent and longer term needs. And the UN cannot deliver the response alone on all fronts. The private sector is critical and private supply chains should be restored and basic commodities allowed to flood Gaza. Now focusing on WHO, so we already planning for first to continue, and the first year it will still be very much humanitarian support what we are doing, and then stepping up our support in early recovery, rehabilitation and reconstruction. For example, we have a contract to deploy, small example, temporary prefab clinics and hospitals And they will be linked, it's already planned for, they're linked to the existing hospitals and facilities to expand the bed capacity to address urgent health needs and expand the service delivery in these underserved areas. And the focus of everything we already do, but we will expand with partners, will be, of course, trauma and emergency care, comprehensive primary health care, and it includes everything from child health and sexual reproductive health, non-communicable diseases, mental health, and psychosocial support, but also scale up the international health workers in the emerging medical teams, which we coordinate and bring in, and so-called specialized care teams. Scale up the supply chains via all routes now into Gaza, not just Karen Shalom, etc. And there's agreement working out. So expanding services, which we already do, not just in the south of Gaza, but also in Gaza City, and I can provide you with the examples. We want to expand in all areas, and not only the capacities of hospitals, also the primary health care. The role of the restored health infrastructure, and we have to really focus on very basic things, the partly damaged, utilities like water, electricity, waste management systems, malnutrition is in focus, and of course, restore and better be prepared for epidemics, disease surveillance, and e-wars. Human resources, probably the most important. First and foremost, that we help to ensure that all Gaza health workers can do their job. There's many who've been incredibly resilient to do their job, but there's also many in these makeshift camps, etc., which need to be deployed into the health workforce. Then additional healthcare professional, including external medical teams, to fill some of those gaps. To massively, that's also a short-term objective, massively expand the medevac program WHO prepares. Because at this pace, we estimate, based on our estimation, 12,000 patients, critical patients, they will not be able to get their specialized medical care in Gaza, and they need to be medevaced. And since May, it's only WHO has done that. We only managed to get 450, 460 patients out of Gaza. With this pace, it will take 5 to 10 years. So we rapidly have to restore the medical corridor, the traditional corridor to East Jerusalem and the West Bank, but also into Egypt, Jordan, and then elsewhere. Public health preparedness and the protection will be focused. And last but not least, of course, expand the coordination. Over to you.
Thank you very much, Dr. Rick Peppercorn. I don't see any ads in the room, so I'll go now to Gunilla from Svenska Dagbladet. Gunilla, please unmute yourself and ask your question.
On Trump and the new administration, I understand it is the transition right now, but if the biggest donor standing for 18% of the budget actually leaves, what is your thinking about how this can affect global health work and pandemic response in general? Do you see any willingness for other or new countries to step up in case? This is a question for Dr. Tedros. Thank you.
Thanks. But as I said, we really are giving, this is a government in transition. As for any country with a government in transition, you need to leave them in peace to make their own decisions. I think on funding, it's very important to look at the requirements for funding for the world. We've just had a very big appeal for emergencies, so we do appreciate you reporting on the very, very big needs for funding for global health. But essentially, there's really no further comment to make on the issue. So now I will go, the next question will go to Gabriela Sotomayor from Proceso. Gabriela, please unmute yourself and ask your question.
Thank you. Thank you very much, Margaret. Hola, Happy New Year to all. My question is a little bit unusual. It is about rare diseases. For example, an hereditary disease called EPP. These are people who cannot get the sunlight. They live confined in the dark. The treatment is very, very expensive, and governments do not offer them help. I mean, basically, for example, in Mexico, there's no help for these persons who are with this kind of disease. So migrants, displaced people, ordinary citizens, this could affect anyone. So could you talk about these rare diseases? Thank you.
Thank you. Really, really good question. And we do indeed work on the rarest and look to serve the most vulnerable. I will need you to send the question by email, though, so that I can ensure that we get all the information and the right person to speak to you. But thanks for such an excellent question and for your interest in the neglected and the vulnerable. So the next question, I have Rory. Rory from, sorry, Rory, I've forgotten your surname. I know it so well. Rory O'Neill. Please unmute yourself and ask your question.
Thanks, Margaret. That's okay. Dr. Peppercorn answered a lot of what I was going to ask, but I did just want to ask if he could expand on the rebuild in Gaza. Do you have an idea? You were talking about the need for support from international partners, private sector. Do you have an idea of how much money is required to restore the health service in Gaza to a level that can actually meet the needs of the population there? And perhaps can you comment on Israel's responsibilities once the ceasefire is in effect? What steps can they take to facilitate the rebuild, for example, like opening border crossings and so on? Any further information on what's required? Thank you very much.
Thank you, and we'll go over to Dr. Peppercorn. Yes, I can see and hear you.
Yeah, thank you very much. I think it's, of course, a complex question. There are processes currently ongoing by the World Bank, the EU, the UN, and government to do the so-called RDNA, to do these assessments on each and every sector, and then actually overall. So that's still ongoing. So WHO and my team is very much involved in the work on the health sector, and what we get for initial figures, and I think this is for that is a massive. You talk about 3 billion over the next 1.5 year. And over the next 6 to 7 years, you talk about only for health, something like 10 billion. But I don't want to speculate too much on that because that is still ongoing. All the work and the assessments are ongoing. And it has been, of course, incredibly difficult to do any proper assessments. We all have been focusing on the most basic humanitarian needs. And we then on health as WHO, leading and coordinating the health partners, but all the other other UN organizations, agency funded programs, international NGOs, national NGOs, etc. I'll focus on the basic humanitarian support. We all know how difficult it has been to do any analysis and assessment, but if you look at the health itself, and myself getting into missions into Gaza every second month for a number of weeks, etc. First, Gaza, we all know the destruction is so massive. I've never witnessed and never seen that anywhere else in my life. So that's overall. So if you think about infrastructure, if you think about general issue, and if you look at health, all hospitals are either damaged or partly destroyed. That same applies for the primary healthcare clinics as well. So yeah, when my team came back, I mean, like with this initial assessments for it was even more than 3 billion for the first 1.5 year, and then actually 10 billion for the 5 to 7 years, I was not surprised. And then we're just talking about health. So the needs are massive, but I think for the coming period, we should remain very pragmatic in what we do. So the focus over the coming period should remain very much on humanitarian support, also on health. And it's everything I mentioned, I think, in my first response. And then, of course, rapidly expand. And then, of course, assuming that the ceasefire processes, which is 3 phases, that it progresses to a lasting peace, and that's absolutely necessary, a lasting peace, that we rapidly expand in this early recovery, rehabilitation, and reconstruction. It is also, and already having discussions with the Ministry of Health on this as well, which might sound odd, it's also, of course, an opportunity to relook at sectors, including the health sector. So how can we now really base it properly on comprehensive primary healthcare, which was not always the case. It was more a hospital-centered system. So how can we do that? How can we work with an updated essential health package for Palestine, an updated essential health package, which should be the basis of all investments? A lot of work was done already before the crisis on this, and we're working with government and partners to further update that. And those processes should guide any investments. So work is ongoing on that. The cost will be enormous. But what is now needed is a continuation of humanitarian supports, pragmatic humanitarian support, and I really would say flexible funding. The WHO, we're finalizing our report over 2024, and we are finalizing our operational response plan for 2025. And it will focus on this humanitarian support, but of course an expanded component on early recovery, rehabilitation, and reconstruction. And focusing, and I think Mike Ryan mentioned that as well, on the so-called humanitarian development nexus and everything related to that. Over to you.
Thank you very much, Dr. Peppercorn. Now we have Christian Ulrich from Deutsche Press Association. Christian, please unmute yourself and ask your question.
Thank you, Margaret. I'm just continuing on from this conversation. So my question to Rick Peppercorn, or maybe someone else, who is going to foot the bill on the reconstruction of the Gaza health sector? Are you looking to Israel to fund this, or is there an obligation maybe on Israel to foot a big part of this bill? I wonder whether you have any thoughts on that.
I'm not sure that that's really in our territory, but I will hand it over to Dr. Peppercorn because he's the expert.
Margaret, if you say it's not really in our territory, I'm not sure you should give it to me, but let me try to address that. I think this is really a collective responsibility and from member states and partners, including Israel. And if you look at it, this is also a chance and opportunity, if we really get a lasting peace, that we get a long-term solution. And a long-term solution will require investments and support. Finally, for Palestine, it needs to be a Palestinian solution. So it needs to be a Palestinian solution, a Palestinian government, Palestinian civil society, a Palestinian private sector, with support of the UN, including we very much in WHO in health, and indeed supported and funded by member states collectively across the world, and that includes also Israel. Over to you.
Thank you very much. And we have last follow-up from Rachel Carlson, NPR. So Rachel, please unmute yourself and ask your follow-up question.
Thank you. I wanted to ask why there have been more Marburg outbreaks in recent years.
Very good question. I'll ask Dr. Abdi if he's got some theories.
Thanks. I think that's the million-dollar question that we need to all work together, and it relates to what DG said, how we need investment in preparedness and the pandemic accord. Definitely emergency will happen and we need to be prepared. In terms of specifically where we are seeing more and more outbreak, particularly three things relating coming together: the ecology of the viruses, the human behavior, and the economic situation that are happening here. So viruses have been there and they will be continue, but recently in East Africa and Central Africa, particularly the outbreak we had in Rwanda, the 2023 outbreak in Tanzania, and the suspected Marburg outbreak that's going on currently here. So we are seeing as more people go out into birth area, as more virus laboratory surveillance improve, we will be detecting more outbreaks that's going to happen. That's part of the nature. What we need from us is that preparedness and the readiness required and the timely and the transparency sharing of information so that what saves is early detection, early care. Rwanda has proven that although usually previous Marburg outbreak had a case fatality rate around 80%, when early treatment and early detection happened, they were able to reduce the case fatality rate. So just to reiterate again, we live in a world that's changing, climate change, all that thing, it will be there, but we can prepare so that outbreaks doesn't need to end up large outbreak like the West Africa Ebola outbreak. So early detection, early response saves life, and timely information sharing with WHO, with member states, will always save lives. Thank you.
Thank you very much, Dr. Abdi. And on that is a very good note to end this press conference, but I'd like to really emphasize you've asked a lot of questions about finance, and we've just launched an emergency appeal. We've a really good document which will explain to you how you get bang for your buck. We're just talking about all the things that we need to do to protect health, protect the health of every person on this planet. So please read that document. We've sent it out to you. And I'm going to ask Dr. Ryan if he's got any other points he'd like to make on that. Over to you, Dr. Ryan.
No, Margaret, I think we're almost at time, and I would like to thank to all of the donors and investors who've continued to provide support for the health emergency appeal over many of years. We're trying to raise $1.5 billion to support health emergency interventions across a range of countries and geographies and settings and events for the next year. I hope, even in the context of contracting resources, that we can continue to do so. The needs are growing exponentially, as I said previously. The pressure of conflict and displacement, of climate change, of contagion and epidemics have really intertwined and mutually amplified across huge geographies in this world. And we are dealing with the consequences of human behavior. Conflict is human behavior. A great proportion of disease emergence, amplification, and dissemination is driven by human behavior. The previous speaker, or the previous journalist, asked about Marburg ecology and evolution. Many diseases are accelerating in terms of their emergence, their amplification, and dissemination. We've seen Mpox, we've seen Marburg, we've seen Ebola, we see cholera, an ancient disease that scourged the humans for centuries. Is being driven by climate change, driven by droughts and floods, but also driven by human poverty, by human exclusion, by marginalization, by hundreds of millions of people who live in fragility, who live in overcrowded slums without adequate access to water and sanitation. So when we look at the risks we face, sometimes we tend to blame nature and we say that these pathogens and disease X are out there planning their assault on humans. They are not. We anthropomorphize pathogens at times and give them brains that they don't have. Pathogens are very simple things. They exploit opportunity, evolutionary opportunity. That opportunity is mainly provided by man. The way we exploit the environment, the way we manage the environment, the way we abuse the environment. And much of what we're doing is driving disease emergence. Much of what we're doing is allowing those diseases, once they emerge, to amplify quickly in human populations. That can be amplifying in an underprivileged slum. That can be amplifying in an underserved hospital where infection prevention and control is not adequate. And those diseases can then disseminate globally very quickly because of the connectivity we have on the world. So whatever threats we face today, it's not because nature is planning our demise. It's because we as humans are leaving huge gaps in the protection of our populations, both from those diseases and the vulnerabilities we leave in place in society that allow those diseases to not only exploit and spread, but to kill. And much of the death and destruction, and Maria referred earlier to the death and destruction from COVID, much of that death and destruction was mediated by the fact that so many of our people have underlying conditions that haven't been adequately treated, have poor access to healthcare, could not get access to oxygen, could not get access to intensive care when they needed it. So in as much as the pathogens are causing problems, it is our system and our society and the way in which we misdistribute health. In a sense, we distribute health in an equitable fashion. We cause financial hardship to hundreds of millions of people on this planet because they cannot access healthcare without economically destroying themselves and their families. So we do face major challenges, but we also have hope. We have fantastic hope. We have hundreds of thousands, millions of healthcare workers out there working in surveillance, working in public health, working in frontline primary health care, working in maternal and child health, working on trauma in places like Gaza. There's a front line, a thin line of health workers in the world who bravely step out every day. They go to work to save lives. Our job is to support them. Our job is to find the funds to support those, particularly those working in compromised and complex situations. And I do hope today that our member states and our donors and our investors can continue to invest. I'm speaking to you from Kabul in Afghanistan. It's been an amazing trip here. I've spent my time with our country representative, Dr. Edwin Salvador, met many, many people at different health centers and met our partners. I'm absolutely amazed at the way in which Afghan health workers, men and women, are continuing to serve in the system here, and the way in which our health partners continue to support them. So I leave you with a message of hope that for a very small investment, we can change the experience and the life course of millions of people on this planet. We need to make that investment, and we need to focus on protecting the health of populations and providing for their health needs. Thank you.
Thank you very much, Dr. Ryan, for giving us some hope, bringing hope in 2025. And on that note, I will hand it over to Dr. Tedros to close the press conference.
Thank you, Mike. That was excellent. So nothing to add. And I would like to thank the members of the press for joining us today, and Happy New Year. See you next time.